Dr. J welcoming you to this video. Over all these years of my practice, the one thing that I commonly find in new mothers is the appearance of the newborn. The cosmetic look of the baby is really important to the mother, and all mothers get worried if they find any kind of rashes or bumps or bruises on the baby's skin. And why not? In this video, we are going to look at some of the common rashes that are found in the newborns. The first one we'll talk about is called Millia. Millia are tiny white pearl-like rashes that are mainly found on the tip of the nose or around the nose, on the chin, or around the eyes. And they're tiny, white, and shiny. Now, this is usually caused by secretions in the skin glands of the baby. It's a harmless rash, does not require any treatment, and usually disappears by 1 month of age. The second one, which is a more angry looking rash, is called infant acne or acne neonatorum. These are small, raised, red rashes with a white head, actually resembling acne like in adults. And they're pretty angry looking and a cause of concern for the mothers. Now, this one is usually caused by the maternal hormones that have been passed on to the baby prior to birth. And this rash is usually around the face. Again, does not require any treatment, just keep it nice and clean, and this takes a few weeks to go away. The next rash is erythema toxica. About 60 to 70% of babies are born with this kind of rash. Now, this rash is also a pretty angry looking rash. It is red, blotchy, with pale to yellow heads or bumps at the center, and gives an appearance like a hive. When you see hives in grown-up people, just like the hives, raised. Now, this usually appears on the trunk and also goes down to the extremities. So mainly on the trunk and then on the arms and the legs. This usually appears in the first few days after birth and will usually subside in the first 2 weeks of life. Again, just keep it nice and clean, maybe a little moisturizer on the skin, and that's it. Does not require any further treatment. The next one is a real cause of concern to all mothers when they see cradle cap or seborrheic dermatitis, as it is called, on the baby. Now, this happens in the first few weeks of life, and it is a patchy, red, scaly rash that happens mainly on the scalp, and sometimes will go on the forehead, on the face, and behind the ears. This again is caused by the maternal hormones that have been crossed over to the baby prior to birth. Now, seborrheic dermatitis can take a long time to go. And the management of seborrheic dermatitis is very important, because for some reason or the other, I find that mothers are very scared to touch the scalp of the baby, especially the soft part of the head, the fontanelle. Now, I have already said in an earlier video that the fontanelle or the soft spot is a pretty strong area, so you shouldn't be scared to touch it. Now, the best advice that I can give for seborrheic dermatitis or cradle cap is that shampoo the scalp regularly, and just after you've given the bath, when the scalp is a bit soft and the scales are a bit soft, try and remove them with a fine comb or even with your fingernails. Because if you leave these scales here for a long time and they attach to the scalp, sometimes an infection can start under this scaly rash and give rise to actual infection of the scalp. And I've seen this happen, and that is a source of discomfort to the baby and not a very good thing to have. Just applying normal moisturizers on the face when you have the rash, it will help. Sometimes if the rash is not going away, with just normal moisturizers, then your doctor might prescribe a very mild hydrocortisone cream to apply on the affected areas, and that will help the rash. In any case, all the rashes that we have discussed are transient, temporary, and do not cause any problems and do not require extensive treatment. Thank you for watching this one. I'll see you in the next video soon.